afternoon, everybody. I'm Priyanjali from Men's Good Health Team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, which is kidney stones. Kidney stones are more common than we think. They affect millions of people each year and can cause severe pain, discomfort, and even long term kidney problems. If not managed properly, but the good news is most kidney stones are preventable, and with right knowledge and lifestyle choices, they can be effectively managed. To throw more light on the subject and guide us on kidney stones, today we have with us renowned urologist Dr. Amit Chiddarwar, MS General Surgery, KEMH Mumbai, MCH Urology, Sion Mumbai, consultant urologist and andrologist. He is currently practicing at Chiddarwar Hospital, Chandrapur. With that, doctor, I would like to welcome you to today's platform. And the first question for you would be, what are kidney stones and how are they formed?
So, kidney stones are basically the crystals of minerals which are formed in the stagnant urine. So, which grow the crystal grows over time, it solidifies over time and gives rise to the formation of stones. So, the reason for the formation of stones are numerous, starting from genetic to the diet we consume, to the water we consume, to the area we live in. Because the hardness of water we consume, the minerals which we take on a daily basis, and the genetic factors as to the how much minerals are excreted in your urine, all these factors amount to the formation of kidney stones. So kidney stones usually start small, means normally they all starts as a nanocrystals which eventually grows in size to, it can grow up to 5 centimeter in size and lead to non-functioning of kidney. So it's very necessary to get it diagnosed early and treat early.
Right. Doctor, let's know about the identification of the condition. I mean, the main problem occurs when we are not able to identify the disease or the condition in the
Yes,
initial
yes.
stage. So, what are the
Yeah, so
early symptoms like?
yeah. So the good thing about renal stones is that it can never be missed. The symptoms of renal stones are so severe, the renal colic is so severe that it cannot be missed. Usually, the first episode of renal colic happens when we have a flank pain which is radiating towards the suprapubic area, towards the area from where we void. And the pain is very severe, and most 99% of the patients experience this pain as an initial symptom, and it is associated with vomiting, nausea, anorexia, we don't feel like eating, and but the pain is the most prominent symptom of all that. The problem starts when patient do address this pain, but once they are diagnosed with stone, they don't get it treated. They feel like it may pass out, and they will they will get resolved. The pain subsides initially, but the stone stays there. The pain
Mhm.
is experienced only in the initial stages when there is obstruction. Once we symptomatically treat the pain with analgesics, the pain doesn't recur most of the time, and the stone just increases in sizes, grows in size over time, and that leads to the major problem. So we need to address those problem and get it treated as advised by the consultant urologist.
Right, right. So, what is the first step which we take in when a patient comes with the pain, which you have already
So
mentioned?
when a
Which
patient
area does
come
the
with
pain
pain,
occur, and what is the
yeah.
first step that we take in?
So the first step is obviously the pain relief whenever the patient comes in acute colic. But the second step to diagnose the condition as to what is causing that pain is ultrasound. Ultrasound gives a very good picture as to what is the pathology going on behind the cause of that pain, and it just shows where is the stone, the size of stone, and what side effects or complication has been caused by that stone. But we need to evaluate it further before any intervention by the use of CT scan. So the first step is sonography, ultrasound, followed by CT scan and blood test, obviously.
Right. So, doctor, what is the next step? Like, initially, we generally offer medicines to the patient, and then I
No,
hope
it
we don't go
depends
for the
where the
surgery
stone
directly,
is.
or
The
do we?
renal stone is quite a broad term which we use. The stones could
Mm-hmm.
be in the kidney; those are called renal
Mm-hmm.
stones. It could be in the ureter, that is the structure connecting kidney to the urinary bladder, which are called ureteric stones, and there could be urinary bladder stones called vesicle stones. So, depending where the stone is and what is the size of stone, the intervention or further management is decided. Only stones up to the size of 6 to 7 millimeter can be passed with medical intervention, or even without medical intervention with increased consumption of fluids. But any stone which is more than 6 to 7 mm, those need surgical intervention for sure, irrespective of the location of stone. So up to
Right.
7
So,
mm
when
of
we
stone, because most of the patients are diagnosed with sub 5 millimeter stones, which can be passed with plenty of fluids, which don't need any intervention at all. Only stones
right,
which are up to 6 to 7 mm and they are stuck or obstructed in the lower ureter, only those stone can be tackled with few medications which will dilate those ureter and let the stone pass off.
right. So now that we're talking about the treatment options, doctor, as you mentioned, that surgery is not required in all the cases, only when the stone size is at the amount which you have already mentioned. Only then we normally opt for surgery. Uh, so moving ahead, doctor, nowadays we know that even nowadays when we talk about surgery, people they seem to worry a little. So what
Yeah.
about the surgery for kidney stone?
Yeah, the
How
surgery for
easily can
kidney
it be done?
stones are the best amongst all because those are completely scopy guided. There is no incision involved. Those are completely painless surgeries. So the anxiety regarding surgery has to be eliminated because there is no pain intra-op, post-op, or any course over the complete course of treatment. There is no pain to the patient because the surgeries are offered for all every type of stone. The surgery is offered through scopy, which are inserted through natural orifices, that is urethral meatus, from where we insert the scope and the treatment is done through the scope using lasers.
Right. Now, moving ahead, as you already mentioned, surgeries are hassle-free nowadays because of the the development in medical sciences with time.
Yeah.
Surgeries have become very hassle-free, provided you are visiting an expert and
Yeah.
not becoming your own expert. So you should
Yeah.
always suggest the expert whenever you're trying to
Definitely.
do any change with your body. Moving ahead, doctor, water you said, drinking water, drinking sufficient amount of liquid is very important. So what if there is a family history? Uh, uh,
Yes.
okay, firstly, coming back to this topic, does kidney have any genetic predisposition? Is it possible?
Yeah, definitely. There are genetic predispositions. Usually, when the parents have the history of kidney stones,
Mm-hmm.
even their offspring children do suffer from the same after a specific age group. So there is a
Right. So
genetic
if
component, but we can't do anything about that genetic component. What we can do is we can prevent stone by taking simple measures like increasing the amount of water which we
mm-hmm.
take on a daily basis.
Right.
So the
So
amount
what
needed
amount?
is at least 4 liters per day. So as
Right.
we produce urine of at least 2 to 2.5 liters per day. That is the minimum
Right.
requirement.
Right. Also for the people who does heavy workout or whose daily schedule includes a lot of physical labor,
Yeah,
do they need to
the
increase the
amount of
amount?
water required for them is more. As I said, the amount of intake is not specific. What is specific is the amount of urine which we void. We need to void at
Mm-hmm.
least 2 to 2.5 liters per day. For that, if we require to intake 5 or even 7 liters of water, that is, if it is required, then we have to take it as according to seasons. In summer, we require more amount of water than in winter. So accordingly we need
Right.
to hydrate it.
Right. So a lot of people might be thinking that why are we even talking about water? We know that we have to drink water in general,
Yes.
but we tend to miss out on the basic things mostly. So a lot of people, they do not know how to drink water as well. So just because they have to complete the daily quota of having water, they'll have 1 liter of water at once. I've seen so many influencers nowadays. They wake up in the morning and they say, "मैं daily सुबह उठते ही 1 लीटर पानी पीता हूँ या पीती हूँ." So, is this the right way to drink water? If no, what is the right way to drink water, doctor?
Actually, there is no as such a right way or a wrong way to drink water.
Mm-hmm.
We need to build a habit of drinking water even when we are not thirsty. So,
Right,
drinking large amount of water at once is not physically possible. You just can't force drinking water in such a large amount, around 1 liter at once. That is not possible. What is possible is taking 250 ml, that is a glass of water, every 2 hours, which is very easily possible. So what we need to do is build habit of drinking water even when we are not thirsty. And once the habit is built upon, then it's not that difficult to have that daily quota of water.
right. Now, quickly diving back towards the next question, doctor. We have talked about hydration. What is the importance of diet in kidney stones as well, or is there any importance of diet?
Yeah, there is importance of that. But as compared to previous myths, we don't have to restrict very much in diet as we were suggested upon earlier. What we need to do is we need to restrict the amount of salt intake. That doesn't mean we have to take saltless food completely. We just have to limit the extra added salt which some people have the habit of having. We need to cut upon that. We need to cut upon the amount of protein intake. We like few people have a habit of having non-veg every day, which need to be cut upon up to once a week, not more than that. Other than that, few uh, things like chocolates and walnuts, which have high amount of oxalates, like coffee and tea, we need to restrict upon that because calcium oxalate is the most common stone which is formed. 95% of stones are calcium and oxalate component stones. So we need to restrict the amount of oxalate which we consume. The earlier myths that we need to restrict upon milk or complete calcium restriction, that is false. When we restrict calcium completely, the amount of oxalate that get absorbed through our gut increases proportionately. So the incidence of stone doesn't decrease but increases otherwise. So we don't have to restrict calcium, but we have to restrict salt. We have to restrict protein, and the few things like chocolates and coffee. And other than that, the most important is increase water intake. That's all.
Right. Now, that was about water intake and about food habits. What about lifestyle, doctor? Does our lifestyle also plays a very important role? What are the do's and don'ts?
The lifestyle, the role of lifestyle like exercise and all that doesn't affect the prevalence or incidence of stone to that level as does it affect cardiovascular health. The role of lifestyle is that not that significant as is diet and water in this case.
Right. And what about the habits, doctor? We see a lot of people, um, they have a habit of smoking or alcohol. We have also heard people saying that consuming an amount of alcohol or consuming an amount of beer can somehow flush out the
Yeah,
stone. Is it
yeah,
possible?
yeah,
Is
yeah.
it true?
Yeah, there is actually the beer doesn't do anything. The
Hmm.
amount of beer which we take is in liter, around 1 liter, 1.5 liter. When a patient consume 1.5 liters of beer, he
Hmm.
is consuming 1.5 liter of fluid. So obviously he is going to void that much urine. And as I said earlier, the more urine you void, there are more chances of stone getting passed off. So there is no medical significance of alcohol in that passing of stone. It's just that along with alcohol, we consume 1.5 liters of water. The alcohol is fluid, and that fluid is excreted via urine, which causes the stones to flush out. There is no reason of that specifically alcohol causing the flushing out of stones. So that is a myth which is carried quite commonly along.
Right. So it can just be an excuse for people to consume it. Please do not trust such myths. Now, moving ahead, doctor, coming back to surgery once again. Let's know about the surgeries which are currently available, or people if they are wanting to opt for any surgeries. What are the current scenario?
Yeah, as I mentioned previously, all the types of surgeries are scarless or incisionless surgeries which occur through natural orifices, like the orifice from which we void. The scope is inserted through it, and depending on the location of stone, the surgery is performed. When the stone is in urinary bladder, it is called as cystolithotrypsy, whereas when it is in ureter, it is called as URSL, that is ureteroscopic lithotripsy, and when it is in kidney, it is called as PCNL, that is percutaneous nephrolithotripsy. So all these surgeries are painless, scarless surgeries, which are very hassle free and painless to the patient.
Right. Now, doctor, moving back towards the questions once again, um, we know a common problem when we are talking about kidney stones. A lot of people can relate to it. There is a chances of recurrence. We have also heard doctors saying that once a kidney stone patient, always a kidney stone patient.
Yeah, for this,
There
there
is
is
always a
quite a
chance of
few
recurrence.
advancement in medical sciences regarding it. So, when we perform surgery, the stone which are extracted are sent for analysis, for stone analysis to determine its composition. So, the 95% of the time, the composition is calcium oxalate. When composition is calcium oxalate, the preventive measures are only dietary modifications, which I have talked earlier. There is no medical intervention which will prevent the formation of stone. Whereas if you fall into the rest 5% category, when the stone composition is either uric acid or cysteine or calcium phosphate or any of the other type of stones which are less common, then there are quite a few medications which can be started so as to prevent the formation of stones in the further life. So to prevent recurrence, there are effective medications only in 5% of cases. In rest 95% of the cases, only dietary modification is the thing which can prevent the recurrence of stone, and 6 monthly follow-up using ultrasonography is quite helpful. Other than that, there are no specific medications which could prevent the recurrence.
Right. Doctor, when we're talking about any sort of condition or a condition like kidney stones, we know a lot of people who opt for home remedies. So, does these home remedies work? I know a lot of people who has heard maybe a juice of certain leaf can somehow flush away the stones.
No.
Does these
Yeah,
home remedies
this
work?
works. There is no home remedy which can dissolve stone, and
Hmm.
neither can a stone beyond a size of 7 mm be flushed out of our system naturally. Means our whole ureter size of ureter is 4 to 5 mm. So how can it physically pass a stone beyond a limit of 7 to 8, 6 or 7 mm? At the most, few patients have tendency of passing stone up to 1 centimeter, but no human can possibly flush out a stone beyond 1 centimeter. So if no medications, if our body cannot physically flush out a stone,
Okay, everybody, I believe we are facing a slight. Yes. Doctor, are we audible to you now?
yeah, yeah, yeah,
Yes, we can hear you now.
yeah. So, hello, am I audible?
Yes, yes, doctor, we can hear you.
Yeah. So as I was telling, it is not physically possible for our body to flush out to pass a stone beyond the size of 8 mm to 10 mm, that is 1 centimeter. So no home remedy can help a patient of a renal stone. It can't help pass out a stone, and neither can it dissolve a stone. So there is no role of home remedies in
Right,
genitourinary cancer.
right. Doctor, we also know a lot of people who are negligent regarding their health. They
Yeah.
tend to just prolong the condition for a longer period of time. So, what is
Yes.
the worst case scenario? Does kidney stone affect other organs as well? Can it affect other organs as well if not treated at the right time.
No, the kidney stones cannot affect the other organs, but what can it
Mm-hmm.
affect is kidneys itself. And kidneys
Hmm.
are vital for our survival. If we lose a kidney, there is no treatment other than renal transplantation. We can't recover a kidney which is already damaged. There is no treatment or no medication whatsoever which can regrow a kidney. So we need to treat kidney stones as soon as possible so as to prevent damage to the kidneys. We have two kidney thankfully, so even if one is damaged, we can survive on the other. But that doesn't mean we can be negligent and let go of a kidney at once. So we need to
Right.
treat stones to protect our kidneys itself, because those are
Mm-hmm.
very much essential for our survival, and there is no treatment once kidneys are damaged. We have to protect it from getting damaged.
Right. Now, I can see a few questions coming up from the viewers, Doctor. The first question comes from Amit Jatav, who asks, are kidney stones hard or soft?
Yeah, it depends. The 95% of calcium oxalate stones are hard stones. Rest 5%
Mhm.
stones, that to 1% of those 5%, the stones which are specifically made of uric acid are soft stones, and it can even be dissolved. So that 1% stones are soft and 99% are hard stones.
Right. The next question, Doctor, comes from Firoz Khan, who asks, is coconut water good for kidney stones?
Actually, the coconut water has no such role. Coconut water is high in potassium. So, normally, coconut water is very good for our health. But in patients
Mhm.
of kidney disease, that is end stage renal disease, whose kidneys are already damaged, for them, coconut water is quite hazardous. Because once kidneys are damaged, the kidney loses its function to excrete potassium. So,
Mhm.
coconut water has high potassium, though excess potassium can be harmful for our heart. So coconut water as such, in normal regular with normal functioning kidneys, it has no, as such it is not good, and neither it is bad for kidney stone, but it can be harmful in patients of renal disease whose kidneys are already functioning less.
Right, right. Which is why we always say, please, please suggest an expert before you go for anything if you're having any changes in your body. Now, quickly moving on to the next question, Doctor asks Tanishka Rajoria, can I prevent kidney stones naturally?
Yeah, you can prevent using the advices by following the advice which I have uh, recently talked about, that is increased fluid intake and the dietary modifications which I have told you. Other than that, there are no other ways of preventing stones naturally, like neither there is any changing lifestyle or exercise or anything. There those are all the myths. So there are no other natural way to prevent a stone.
Right. Doctor, what about after the surgery? Can they go back to their normal lifestyle once again of
Yes,
having those
definitely. You can go
spicy,
back to
oily
normal
food?
lifestyle post-op day one. Means if you get
Mm.
operated today, you can go back to normal life from tomorrow itself. So that is
Right.
how quick the recovery is after the stone surgery, because the stone surgery are so minimally invasive or non-invasive at
Mm.
all. That is how quick the recovery is. That's why the anxiety regarding the surgery for kidney stone has to be reduced, because there is
Right.
very quick recovery.
Right, right, right. Normally
Yeah.
we tend to, switch to no oil or no masala food after surgeries.
Yeah. Yeah. That is not the case in this scenario. There is no
Right,
role of oil prevention or any kind of stuff in this.
right. What about smoking, doctor? Can it somehow trigger the condition? Or for the patients who have been through the surgery, can smoking trigger it somehow?
Smoking doesn't cause renal stone, but obviously smoking as overall it delays the recovery after surgery, and it is
Mm-hmm.
harmful in thousand different ways than causing renal stones. It can damage kidneys directly, though it doesn't
Mm-hmm.
cause kidney stones, but it can damage kidneys. So obviously smoking is extremely injurious to health.
Well, we will dive into the last question for today, doctor. Comes from Deepak Saxena, who asks, is milk good or bad for kidney stones?
Yeah, as I told you earlier, it was a myth that the milk is bad and you need to stop having milk if you have kidney stones, because milk contains calcium. But as I told you, that is a completely wrong statement. If we prevent calcium consumption completely, the amount of oxalate absorption from our gut increases, and which leads to increased formation of stone. So the milk is not bad for kidney stone, and we can't say it's good, but we need to have milk in normal regular proportions which we have. We don't need to restrict the consumption of milk or milk products in kidney stones.
Well, that were all the answers for today. I believe we have all got your answers. Doctor, we had a wonderful session today. Before we take a leave, any take-home message for our viewers who has watched us so far?
Yeah, the take home message would be to follow the dietary modifications. If you know you already are genetically predisposed, if your parents already have stones, you need to make those dietary modifications in your lifestyle. And secondly, if you experience renal stone, renal colic, you need to get it diagnosed, treated, and most importantly, you need to follow the advice and follow up with your urologist with the advised investigation as soon as possible, and not to forget that once pain is settled, that doesn't mean you are cured of kidney stone. It just means that the stone is silently growing in size if it has not been flushed out of the body. So you need to confirm the stone free clearance by a follow-up sonography or CT scan.
Well, that was the expert advice for today, and that was Dr. Amit Chiddarwar for us. Thank you so much, Doctor, for your valuable time. It has been quite an informative session for our viewers today, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and updates, stay connected on our Facebook page, Men's Good Health. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and
Thank you.
stay healthy.